Dr. Nihat Salifu from Ghana, a pediatrician. I am at Kolebu Teaching Hospital, which is affiliated to the University of Ghana Medical School, and I'm delighted to say that I was one of the first candidates to be selected by the MEC Oncology Fellowship Program, currently pursuing a course in pediatric oncology at Tata Memorial Hospital. Ghana has a population of about 26 million people, and we have only 3 pediatric oncologists. We don't have any medical oncologists in the country. Cancer care has had many challenges. Our mortality rates in cancer are very high currently, and there are a lot of challenges, including access to care, lack of awareness in the general population, and this also leads to late presentation of cases. Care is also very expensive. Many health workers are not trained in that field to be able to identify cancers and refer them early.
I'm Dr. Christina Valen Malichere from Tanzania, working at the Muhimbili University of Health and Allied Sciences as a lecturer in the Department of Radiology and Radiotherapy. I'm so grateful and thankful to MEC for being one of the first candidates to join this MEC Medical Oncology Fellowship Program. Incidence of cancer has been increasing in our country, while the infrastructures are still the same with limited facilities like treatment, drugs, lab facilities, and diagnostic facilities.
Africa faces challenges in oncology care what India faced a few decades back, and actually in much more magnified form. It has huge limitation in access to oncology care for the entire population. There is limited availability of trained manpower at each level of care, which includes physicians, the nurses, the technologists, the nutritionists and other providers. And there is huge lack of finances to be able to deliver the right treatment with the right drugs in the right intensity. And together these translate into a huge degree of abandonment of care early in treatment, and then increased number of deaths during treatment because of lack of supportive care available in these centers and experience of managing these protocols. So finally, this all leads to a very poor outcome of cancers in African population. So there is a huge unmet need to have a concerted effort from the healthcare organizations, the government, as well as the non-governmental organizations to put their hands together and develop oncology care in these countries and the continent.
We are very happy today to have a partnership with Merck in building up the capacity building of trained and qualified oncologists in sub-Saharan countries.
They're going to be having a dual advantage. First, they will learn the science of oncology and also would know how to adapt that science in the limited infrastructure they're going to go back to. And the second, they will learn also about how to develop the support systems by putting together a social support group, by training nutritionists, by providing training to nurses, and using this limited manpower infrastructure, how to adapt that care in their local countries.
This initiative by Merck is going to be a big step in improving the outcomes of cancer patients in Africa.
I hope that at the end of this training, I'll be able to go back and make a change in my country.
I really believe that this collaborative effort through Merck is going to change the oncology care and landscape in Africa in decades to come.
Thanks to the MEC Oncology Fellowship Program.